So we're back here for part two with Dave and Dan, my colleagues in the business world, my superstars in trying to make the world a better place from their positions as the head of their two different companies and their curiosity and interest in healthcare and holistic medicine and what we can do. So I know you guys have a couple of questions, a couple of big topics that we want to talk about in part two. So Dave, you want to start us off?
For sure. In the last few years, I've lost some really close friends and family to cancer. And so I know that's a topic of interest for me for sure. Can you help me understand your approach to cancer in general from a preventative perspective, and also if you do have cancer, like your treatment options and how do you approach that?
Yeah. Yeah, it's a absolutely massive topic, but I think it's an interesting topic in that it is sort of kind of the penultimate worst case scenario of a disease that, people kind of think of the C word as being the worst disease they could ever be diagnosed with because it has such a horrible track record in our current medical system, and how difficult it absolutely can be to address and to treat. So those of us who do work with cancer like to say, prevention is the only cure, but you can make some really significant headway into late stage cancer patients when you go back and you put together all of the data and all of the research that's been done that isn't just following kind of a narrow view and mindset that's focusing on the disappearance of the tumor. So fundamentally, my approach, our approach, the holistic approach, what we would call the metabolic approach, is recognizing that any cancering process is what grows out of the field. It's not the disease in and of itself, and cancer is not the tumor or the elevated white blood cells. If you're talking about what they call blood dyscrasias, where you have imbalances in the different types of red and white blood cells, that would be, one type where you get too many white blood cells. So that's the kind of the symptom. It's not the cancer. And that's so fundamental for people to understand, because they have it in their mind that just like you can take an aspirin and make your headache go away and your disease is gone, like you can't just cut out a cancer and think it's gone. Like sometimes that will work for a short period of time and in the short term, but it doesn't work over the long term. And we know that it also can engender and flare up even a greater, more aggressive recurrence. Like that has been documented. So even, something as simple as a lumpectomy for a woman who has breast cancer, like she might want to think, let me just cut it out. But the research actually shows, when you go back and you look at that there is no improvement in the statistics around mortality, whether you have a lumpectomy or whether you don't have a lumpectomy. So it actually doesn't improve your outcome to go and cut the tumor out, even when it's a little small. And in many cases, what we do, when I say we, I mean those of us who are really practicing in this metabolic approach that was very clearly is very clearly delineated and being trained to practitioners how to follow what's going on in your blood work related to what's going on in the body and what's creating a cancering tumor. It's a process where the body creates that symptom again, that you have to look at what's creating it and following. Yeah.
Question: You're using cancering as a verb,
Yeah.
right? That's interesting.
Yeah. I wish that there were a better pre-existing word for that, because I know that people are like, what does that mean? But what I really mean by saying someone is cancering is that they have enough markers of inflammation, oxidative stress, angiogenesis. If you look at what's actually called the hallmarks of cancer, you can look it up. It's all of the hallmarks of how a normal cell loses its basic capacity to burn fuel in the way that it should. It loses the capacity to die when it should. All of these different characteristics, when you look at that, the process of cancering is when somebody has all of these different markers in their conventional lab work that indicates that they are very likely creating a metabolic state, meaning the way that an individual fuel processes and makes energy. They're creating a state that's actually engendering the cells to regress to an embryologic form where they have no differentiated purpose for like a liver cell. They're more like a little blob, a little like, they're almost like a microbe, really. They're like a fungus because they start fermenting, and then that's what's creating more of this cancering process. So I love that you pointed it out, and it's such a huge topic, but it's the fundamental piece we're trying to get patients to understand, that like we really understand why you have cancer. We can explain it to you. If we look at your life history and we look at all the course of the medicines that you've taken, we look at your blood sugar markers, we can see it. It's plain as day that you've been making this over, a decade or more.
Erin, when do those patients come see you, and when do you wish they would come see you? Like when? Tell me about the timing of your treatments.
Well, really we'll take anybody at any point in any time. I much prefer that they come to us prior to the very end. Obviously, that's going to make things a lot easier when things aren't so deranged and so broken in the basic physiology, where very normative biochemical processes are so impaired. That becomes very difficult, but yet is still something that we have a lot of tools that we can push back on. Unfortunately, we don't have a lot of them available to us for somebody who's very, very late stage, like things such as hyperthermia, whole body hyperthermia. You can't even get anywhere in the United States right now. We're starting to see hyperbaric oxygen, but even that is something that has to be done in a very specific metabolic state, meaning you can't use hyperbaric oxygen when somebody is not in ketosis, when they're an active cancer patient. Ketosis being a metabolic state where you're burning fat for fuel instead of glucose. Then also, IV mistletoe therapy. That's something else that's very hard to get at that can be used. But to get back to your question regarding when do people come, like it's so much easier to prevent cancer if I could have been treating that person from the day they were born, or even ideally their mother before they got pregnant, both parents before they got pregnant, right? So like there's the huge spectrum of chronology. I will take you wherever you are. And it's really important for me to explain to the patient that where you are today is a result of your past and your parents' past, your ancestors. They all had something to do to create, your propensity to have autoimmunity or cardiovascular disease or dementia or type 2 diabetes or, of course, cancer.
Erin, I think I'm a good example because I came in for autoimmune disease, and I think it was first or second appointment. Dan, you're precancerous. What you've been doing to your body over time with the medicines you've been taking to fight your autoimmune is going to end in a bad way. And right now you're not coming to me as a cancer patient, but we're going to be tackling that too. And you showed me the markers that we would be following and tracking it, and they did change over time with your prescription, your treatment ideas and recommendations. But you and I also have another issue we need to work on and that we talk about passionately, and it's heart disease. My great-grandfather died in his 30s. His great-grandfather never made it to 40. And my father had a double or quadruple bypass when he was 42. I'm now 55 years old, and I've been taking statins since I was 21. And so far I'm setting records living. So I'm hesitant to change my practice, my standard of care. And I know that you don't like me taking the statins, and I appreciate that opinion, but you can also understand that I have a hard time switching into a new treatment level, not understanding if I'm making progress. And right now, maybe it's not fair because what I'm looking at and I'm blindly believing is that my cholesterol levels are X. When I do my treatments and control my diet, they go down, they change drastically into a range that everyone's super happy about. My doctor, give me a pat on the back and said, "That a boy, keep it up." But how does homeopathic deal with heart disease? Because it seems like something that's just so mysterious and then all of a sudden I could be dead tomorrow. You know?
Yeah. Well, I think, one fundamental premise to start with, Dan, is that it's not as mysterious as you think it is, or that your doctors have led you to believe that it is. And it's not nearly as in sync with cholesterol levels as your doctors and the medical community has, wants the public to believe. The pharmaceutical industry wants the public to believe this. They've talked about putting statins in the water, and statins are killing your mitochondria. So, then we're back to this issue of, are you really, is your risk for cancer gone down as far as we think it has when you're taking these medications over a long period of time? So again, going back to this holistic theory, we can't just make an assumption that you're safe because you're taking a certain drug, because that's what the dominant medical paradigm is telling you. Now, beyond that, I would say we absolutely can look at some other markers, some of the same markers we looked at for the autoimmunity, and some of the same markers we look at in relationship to cancer. And Dave's question, there's a relationship between all of these things. So a colleague of mine, prestigious naturopathic doctor Nasha Winters, she said something to me one day that really made me think. And I thought, this woman is absolutely brilliant. And she, you know what she said? She said, cardiovascular disease is the penultimate endocrine disorder. And I was like, what? And I'm like, oh, I get it. It has to do with hyperinsulinemia, you see. So it's the metabolic hyperinsulinemia. Okay, Dave's like, please define that for me. Okay, so think about how we ate before modern agriculture. Before we had grains and beans, we were, hunters and gatherers were eating lots of vegetables, and we were eating nuts and seeds, and we were eating meat, and we were eating fat. We were not eating grains, beans, carbohydrates, tropical fruits being trucked in 365, 24/7, 365, anytime you want. What has happened to us as human beings is we turned our metabolism that was used to having long periods of starvation or, not eating, and then refueling with optimal fuels that come straight out of the earth, to all of this, progressively higher amounts of carbohydrates and foods that turn into glucose in the body. So that's like really fundamental. Our insulin levels are way higher than what they were 200 years ago. And the Industrial Revolution and agriculture, all of these things played a role in upping insulin. Insulin's now thought to be a stress hormone. It's a hormone that the body is saying, get the glucose out of the blood, get the glucose out of the blood. But we don't look at it that way anymore. I mean, the reference ranges on insulin go up to like 34. We consider an insulin level above 3, maybe 5 to be too high. So insulin is, Dave, what tells your body to take excess amounts of glucose and store it away, right? Get it out of the blood. And we start to get resistant to that molecule the more and more and more we pile on the carbohydrates. And this is now, multiple generations deep that we're talking about. And this is Dan's family we're talking about. So it's part of what contributes to breaking your mitochondria. And the mitochondria are those little buggers I was talking about in part 1, those little microbes that we made part of ourselves. And we have 10, I think it's 1 million billion mitochondria in us. And the more we lose them, it's absolutely related to aging, chronic disease, type 2 diabetes, cancer, Alzheimer's, cardiovascular disease, all of the diseases of modern society. Those 3 big killers, heart disease, cancer, dementia, which we actually call type 3 diabetes. These are the things that we're forgetting. It has to do with how we make our energy in our body, how our cells work. So it's all related. And a holistic doctor like myself doesn't really even see them as separate disease entities. I'm looking, Dan, at you as a person, a whole being, and there's all these different parts and ways that we can differentiate out and intellectualize it and put it into different categories and send you to this specialist and that specialist and this specialist to deal with this and that. No, it cannot continue to work that way, because we're missing the boat when we put you on a statin and think that we're saving you from your cardiovascular disease. But then by the time you're 66, you start having short-term memory loss that then starts, we're seeing more and more and more dementia. So, we just morphed the disease into something else when it was really the same disease to begin with, and we gave it a different name. That help?
That was very insightful. So, so going back to your prestigious doctor friend, and you said, okay, that's enlightening to me, right? Can you just finish that thought for me to bring that one home?
Yeah. So the thing to me that was so fascinating about her saying that cardiovascular disease was the penultimate endocrine disorder. The endocrine system is all of your hormones, all of your glands that secrete any kind of hormones. You have your hypothalamus and your pituitary, your pineal gland, the really important structures in the brain, kind of where it begins and how it's directing the rest of the body. And then you have your thyroid, your adrenals, your ovaries, and your testes. And then, of course, your pancreas. It has both what's called an exocrine, like a digestive function, and it has an endocrine function, more of a hormonal function, and that's secreting the insulin. And then, of course, the liver has glucagon, and this whole dance of all of these different molecules going around in the body. The endocrine system is so fundamental to everything, and it's such a beautiful way that it interacts with the rest of the body, signaling what needs to happen. And there's even relationships to what we know as neurotransmitters, like our mood and how we respond to stress, and how all of that then also drives cortisol and more insulin. So cardiovascular disease is penultimate endocrine disorder. When you look at it being the kind of final stage of someone who's, very type A, very stressed out, driving up cortisol levels, which is driving up insulin levels, which is driving up type 2 diabetes and hyperlipidemia, elevated triglycerides, fatty liver. Then you get into the whole association with high states of blood sugar killing mitochondria. And then you have all those metabolic diseases, dementia and cardiovascular disease and cancer. So cardiovascular disease is really, it's that broken metabolism. It's that hyperinsulinemia that's driving the blood sugar imbalances that only get looked at in these little kind of pips and squeaks from a conventional medical analysis, where they're going to check your hemoglobin A1C and they're going to say you're fine when you're 5.6, but 5.8, 0.2 higher is prediabetes. Well, we would take away those constructs of, crossing a threshold and then you're in prediabetes. We'd say anything above 5.0 is showing some signs of a blood sugar issue. And then we'd also be looking at triglycerides and insulin levels, and even insulin-like growth factor, which is highly correlated to stress levels, to determine if you've got a metabolic issue. And then even something like uric acid, which tells you how well it is how stressed are the individual cells of being able to just, move acid out of the body. And that acid is a result of those, broken metabolic processes. So, there's a lot of biochemical terms I'm using here, but what I'm really talking about is we have become so disconnected from understanding how our history of what we eat day in and day out and what we choose to eat plays a role on our chronic health and what we can do about it in that relationship. So does that help, or is that a little bit too high level?
No, it's a lot to take in for sure, but it's very, very interesting.
And Erin, just to follow up on that, I know in my treatment, one of the core pillars was a significant reduction in carbohydrates, changing that. Obviously I'm in the world now with other people, and everyone's looking at what Dan does and think that that's a Dan thing. But are there things that you could generalize about that all people should immediately either start or stop doing, that that we're all making the same mistakes out there and we're just ignorant to it? What would you recommend if you had a couple hundred people and you want to benefit them and you only had a couple of minutes to say, stop doing this, start doing this? Is there a possibility to do that?
Absolutely. There's some really, really fundamental things that I think people need to do. I mean, first of all, I think people have to come really to terms with anxiety and fear that they have, and being really honest with themselves about what they're terrified of with respect to their own health. Because I see patients getting crippled every day because they have so much anxiety, they can't make some of the necessary changes that they may logically know they may need to make, but emotionally they're not able to do it. So that's, that's really fundamental. And that's not.
Stand on that, because that, I get it, but I don't get it.
So
Are you talking fear of just a disease that I might think I have, or fear that I carry with me every day of losing my job or losing my wife?
yeah, it's really, I'm talking about really all of it. So it's, it's probably something for part 3, 4, or 5 of our conversation. But I think fundamentally people have to really become more aware of their thought and how they're thinking and how that informs what they're doing on a day-to-day basis. I mean, we have people who do stress eating, who do emotional eating, who can't make the normal kind of changes, the healthy changes that they know they need to make because they're so stressed out, or they're so afraid, or they're so, like, whatever it is. Like, we have to fundamentally get people back to a daily practice of being able to know how to settle themselves, to know how to meditate, to know how to, get your sleep well, how to get your circadian rhythm back on track. These kinds of things are really fundamental to even being able to make a change with your diet. And, I recognize some people are in a very, very difficult place because, they're out of a job with this pandemic, or, they were already coming from a place where they didn't have a lot of control over that. But the reality is that every time you eat something, every time you drink something, you're making a choice about your health now and in the future. So developing an awareness of what is it that's preventing me from making good choices, or, making that a priority in my life. It's both an intellectual understanding as well as an emotional.
Is that easy to identify?
What's that?
So good choices, you're assuming we all know what good choices are, but we're just too stressed out to do it. But let's say I have any stress and I don't even know what my choice, what should I do?
So there's going to be a lot of information wars about what the good or not good choices are. So I would say, certainly I have an opinion about all of that. I got kind of alluded to that, talking about this whole history of, increasing carbohydrates in our diet. So that's pretty fundamental. And, Michael Pollan said it pretty succinctly, eat, a little bit of food, eat mostly plants. Like, there's this whole plant-based medicine movement, but we've got to also remember that the body does need, fats, and that gets overlooked. And the relationship between, fats and carbohydrates and how they turn into ketone bodies and glucose gets overlooked and is misunderstood. So all of it has to be looked at, but fundamentally people won't make a change if they don't have some level of self-awareness around, where their anxiety lies and what's prohibiting them to move forward. Essentially, just trying to summarize the thing that Dan, you were asking, what are the main things that someone can do? I think we have to start with just kind of basic mental, emotional health first off, and then basic choices around every time we eat and drink something, we're making a choice that's effectively helping us to improve our systemic health, what I often call the terrain. I know that's a term that Dave has had a lot of questions about. But Dave, I think you had another question.
Yeah, I was just curious to see what are some common themes that you're hearing on pushback on going to a naturopathic doctor, or some of the things that people that keeps them from even trying this new approach, or this, I guess it's not a new approach, it's kind of an old approach, but
the original approach, I would call it. Yeah. Definitely people have this, this vague idea that you get worse before you get better, or they think, there's no research, it doesn't work, that there's the piece around money, like people have to pay directly out of pocket usually for this kind of care because it's not part of the mainstream system in the majority of states, even though in some of the states where they do acknowledged and licensed naturopathic physicians, West, East Coast, mostly some of the smattering of states in the middle of the country now do too. You're not going to get the same kind of insurance coverage for it. And you're certainly not going to get your refrigerator stocked by your medical insurance, which is where the real medicine is, or your garden for that matter, which would be even better. And you're not going to get supplements paid for. So, there's a lot of resistance that comes around the money piece. And I think all that goes back to this, whole holistic view around how we have come to a place of dominating nature with technology and science, and forgetting that we are organic earthlings.
I think I've had to deal with explaining to my loved ones why I'm going to a naturopathic, because they all care about me a lot. And one of the comments, and I bet you a lot of people think this, is I get the comments, why would you go to someone that's not even a doctor? And could you address that? Because Erin, I respect you highly. And in my view, you're more educated on the human body than any doctor I've ever met on the broad spectrum. And in fact, you are a doctor, but I think that's a misconception. Maybe you could dive into that.
I would love to dive into that, because it really is, it's a misconception that is so deeply engendered into all of us that it's taken me, the better part of my professional life to get comfortable with being called a doctor, because I myself was like, am I really a doctor? And who cares? Like, what the hell is a doctor? A doctor is just, really a person who's trying to help somebody, right? So forget this stupid term of what is a doctor, other than we have to remember that doctors are really fundamentally someone who is looking at a human being and helping that person live a better life and have less suffering. Docere is the Latin that we use that comes straight from the Hippocratic oath, and this belief that the doctor's job is to teach the patient. And for me, it's about teaching the patient how to understand more about his or her self and developing more self-awareness, because the more you have awareness, the less you're suffering. The less you're suffering on an emotional level, the less you're suffering on a physical level. And they are not just interrelated, they are essentially the same. Rene Descartes, this lovely Frenchman in whatever year it was, 1780 or whatever, he, said the mind and the body are two separate things, and they can be, kind of like extracted from one another. But the reality is that is not true. Like, we are psycho spiritual beings. We are nothing but, as they say now, there's this little brand out there called Spiritual Gangsta. You are the universe in ecstatic motion. Like, in reality, we are nothing but electromagnetic flowing energy. Like, you look at the quantum physics of it, and we've got to start to bring that back into medicine, which is really about having an honored place for the shamanic traditions. And what they do for us is really about alleviating suffering in a being, because you help them come to a new awareness and a new understanding. Am I answering your question at all?
Shamanic.
A different question very well too, and my question. So thank you. Yeah.
Awesome.
Sorry, what's shamanic?
Strumonic?
Shamanic?
Shamanic, like a shaman. A shaman is
right.
all of the traditional cultures around the world always had the medicine man, the shaman. And the shaman wasn't just a doctor. The shaman was helping people deal with their consciousness and their emotional struggles. They were like the spiritual counselors. So like the spiritual counselors and the doctors were really one and the same in the traditional cultures that preceded these westernized approaches that have now, rippled throughout the globe and influenced even the countries in Asia that didn't have those Western traditions, and they had only the holistic Eastern medical paradigms like Chinese medicine, and in Japan they call it Kampo or Kampo, and in India they call it Ayurveda, that all have to do with these more holistic views on the body that include some level of spirit or energy.
Super helpful. Thank you. That was great.